Well, thank you so much for joining me today. So recently you had a cross-sectional survey published in the Journal of the American Academy of Dermatology titled Racial and Ethnic Disparities in Melanoma Awareness. Do you mind going in about, telling me a little bit about the survey and its results?
Sure. So firstly, I would like to say thank you for having me and to discuss this article and my results in my survey. So we all know that melanoma is a very lethal cancer. Despite representing less than 5% of all cutaneous malignancy, it still remains the skin cancer associated with the most number of deaths. So our standard of care for diagnosing this deadly cancer remains a periodic skin examination by a dermatologist, someone board certified, someone trained to look at the skin. Skin self-examinations, in theory, could aid in detecting melanoma at even an earlier stage, thereby reducing overall morbidity and mortality of this disease. But to do this in any proper way, the general public needs to be educated on melanoma and the importance of early detection and of how to perform these self-examinations. So in 1996, over 20 years ago, Miller and his group of dermatologists studied public awareness of melanoma in the US, as well as knowledge of melanoma-specific risk factors and early signs of disease. And what they found, their studies found deficiencies in knowledge of melanoma and the practice of self-skin examinations. The results did support the need for better public education. And since 1996, since that seminal paper, there have been several public health efforts to increase melanoma awareness and an understanding of this disease. So essentially what we wanted to do in our survey was to see, well, has that worked? And what is the current state of public awareness after more than 20 years, after these public education campaigns and after media and social media with our technology platforms allowing for even more widespread dissemination of information. So what is public awareness today and how does it compare to 1996? So essentially what we did was we replicated that 1996 study. We did it to our own patients in modern day. It was conducted in 2017. And the only difference, we used the same questionnaire, was that we offered it in both English and Spanish for our more ethnically diverse patient population.
And can you go in about some of the results that you found in the study?
Sure. So what we found was that deficits in melanoma knowledge and awareness improved. They improved among those born in the US who were white and those with some college education. However, it has remained unchanged in our minority populations over the past 2 decades. In particular, a large group of our patient cohort was our Hispanic population. So overall, we found that melanoma-specific knowledge did improve among those who were already aware of the disease. For example, of those who were already familiar with the term melanoma, the majority, over 50%, knew it was a type of skin cancer, which is an improvement from 1996, which was only about 34%. Another good point is that the detection of early signs of melanoma did overall improve. 65% of respondents in our study today were successfully able to identify early melanoma-specific changes, such as a changing or new mole, and that was compared to only 26% in 1996. But what was interesting was that this wasn't uniform, and race and socioeconomic status were found to be important predictors of melanoma knowledge. So white race and college education were positively correlated with any knowledge of melanoma. Furthermore, awareness of the term melanoma and knowledge that it is a type of skin cancer was lowest among Hispanics and those with a high school education or less. And there was a significant difference in those of lighter skin types to that of darker skin types to the awareness that the term melanoma actually referred to a cancer. So this is important. These results are important because the Hispanic population is one of the fastest growing populations in the US, and they are also disproportionately affected when compared to whites by greater morbidity and mortality when diagnosed. So Hispanic individuals, they've been found to, they're more likely to have thicker primary tumors, later stages of disease, and distant metastases when compared to non-Hispanic white patients.
And going off of that, what did you find the most interesting about the results? Was there anything that surprised you?
Sure. So I do think it's great how overall awareness has increased. clearly public health campaigns do work, and they've largely played a role in the increased awareness that we do see today, that overall increased awareness. And many of these efforts were pioneered and spearheaded by our own Academy of Dermatology in 1997, shortly after this study came out. But the study did uncover persistent deficits and gaps in basic melanoma knowledge across all ethnicities. So what is really interesting is that despite more than 20 years of melanoma education, a racially and socioeconomically diverse real-world population, our world population in 2017, actually had the same understanding as it did in 1996.
That's great. And my last question is, how can physicians help to increase melanoma awareness among their patients, especially those with darker Fitzpatrick skin types?
Our results just support a need for better public educational programs, particularly those geared toward minority populations. This is much easier said than done because issues can be complex with cultural variability and also language barriers. Educational programs that are culturally relevant have been shown to better promote education. So incorporating that is very important as we move forward. At the patient-physician level, we as dermatologists should educate our patients, all of our patients, on melanoma characteristics independent of the color of their skin or their racial background. And we should educate them on skin cancer and to inspect those areas that we see higher occurrences and worse outcomes like extremities and acrocytes in minority populations.